First of all, let's see common thing. The question is, does climbing stairs leave you breathless? If any person is climbing stairs, is diabetic, one flight of stairs or two flights of stairs, and feels out of breath, it sends you a warning signal. And we should be concerned about breathlessness because it can be cardiac invasion, it can be pulmonary invasion. If it is a sudden onset, it may indicate a serious condition like a heart attack or even pulmonary embolism. If it is a gradual worsening, suppose a person is experiencing breathlessness on climbing of stairs, and it over the days or weeks, one is finding it to be increasing slowly. It could be, impending heart failure, which is gradually worsening, or it could be just chronic obstructive pulmonary disease. So we have to see how to differentiate between heart-related dyspnea or breathlessness or lung-related breathlessness. If you have a lung-related breathlessness, you may be having cough, wheezing, and on exertion you may be having shortness of breath. Whereas in heart-related breathlessness, you may feel some tightness of the chest or chest pain, coupled with sweating and restlessness, palpitation and irregular heartbeat, and you may be feeling exhausted and very fatigued. So these could be the symptoms of ensuing heart failure, and this could be this breathlessness or dyspnea. We call it in our terms that it could be heart related. So if it is coupled with cough or wheezing or shortness of breath, otherwise it could be due to pulmonary disease or lung disease. Next slide, please. So just to explain from the beginning, why should you get breathlessness? Why does breathlessness occur? Because once we are climbing the stairs, once we are doing some work, and there is an increased oxygen demand, the body needs more oxygen, and thereby the heart rate increases and breathing also increases. So we need more oxygen. That's why we start becoming breathless. And on the other hand, if eh, okay, any person, that could be in any normal person, but as you do some exercise, you're climbing stairs, your oxygen demand is met by increased heart rate and respiratory rate in the normal person. On the other hand, in a diabetic person or any person is having weakness of the heart, there is ineffective pumping of the heart, the fluid builds up in the lungs and it causes you breathlessness because the proper interface of the oxygen diffusion from the atmosphere to the lungs and lungs to the blood is not occurring. Because of fluid in the lungs, because of ineffective pumping of the heart, one starts breathlessness. So one should be alarmed at when climbing stair one is getting breathless. One should be taking immediate help from a doctor, and one should keep in mind certain points like if there is sudden or severe breathlessness, or as I already mentioned, it is coupled with chest pain or heaviness of the chest, and there is a pressure on the chest, there is palpitation and sweating and body getting fatigued, or there are features of this pending stroke, like you are feeling very weak, along with you have some difficulty in speaking, and there is confusion and dizziness or some vertigo type of the feature. And fatigue is worsening and is persistent. That means you should be alarmed that there something serious is happening, and your heart is not functioning and giving you proper oxygen or effort as required for you to do the climbing of the stairs or fast walking. So just to repeat, because body needs more oxygen and heart is not pumping effectively, you may get all these symptoms of breathlessness, chest pain, palpitation, sweating, and dizziness, vertigo, fatigue, and you should be alarmed at and you should consult your doctor. Next. So this, what I have explained till now, is relevant for anybody, because the anybody going into heart failure will have these symptoms. What is the connection of diabetes and heart failure? It is very important to know for anybody that people with diabetes are 2 to 4 times more likely to develop heart disease than those without diabetes. So anybody per se, like hypertension or otherwise, can get heart failure because of valvular diseases or CAD. But diabetics, they have 2 to 4 more times chances of getting heart failure because of diabetes, because most of the diabetes are obese. Obesity increases the risk of cardiovascular issues and individual with diabetes, because any person who is obese and diabetic, he or she has much more chances of getting cardiovascular problems than a normal person. And once you are diabetic and you are obese, you will likely to have dyslipidemia. But dyslipidemia may mean our lipid profile is not up to the mark. Good cholesterols are low, bad cholesterols are high. So here, as the slide shows, there is high LDL, low HDL, and they contribute slowly to the you know blocking of the arteries, if we say in the common language. And it is because there is a continuous atherosclerotic process going in the blood, because of the high blood sugar that damages blood vessels. There is a high LDL level and low HDL level. There is a cholesterol, you can say, blocking the arteries and plaque formation. At the same time, your blood pressure also starts rising, and because diabetes is often linked with high blood pressure, and that also compounds the whole problem and adds to the risk of getting heart disease. So this quadrant of obesity, diabetes, dyslipidemia, and blood pressure, all these four things are just like we say, adding oil to the fire in our language. So they are complementing to each other to develop the heart failure or heart disease in any diabetic patient. So this is very important thing to know, that you have to be very careful you are having any of the symptoms that I described earlier, and because of all these things, you are likely to have heart disease 2 to 4 times more than the normal nuclear person. Next slide. So here is a slide now which is showing, apart from people who are diabetics, in their themselves further there are stratifications who are at moderate risk, high risk, or very high risk of disease. Any young patient who has a type 2 diabetes in the age, you can say, less than 10 years duration, or the age is less than 50, and he or she is not having other risk factors, like he or she is not a first degree relative of a diabetic person, there is no previous history of the heart disease in the family, a person is not hypertensive, one is not a smoker. Okay, all these additional risk factors, if you don't have, you are a relative at the moderate risk of developing heart problem. But if you are having diabetes of duration more than 10 years, but there are no documented target organ damage or any other risk factor, additional risk factor, as I have already enumerated, you tend to have slightly higher risk of getting heart problem as compared to the previous category. But those people who have established diabetes of more than 10 years, plus established cardiovascular disease or any other target organ damage I mean, you have some neuropathy, you have retinopathy, or you have uh, nephropathy, I mean CKD, or there are 3 or more major risk factors I have already enumerated, and diabetes is more than 20 years of duration, one is having a very high risk of developing heart disease because of the diabetes being the underlying factor. So this is the stratification done by most of the, you can say, associations, whether it's ADA or with the American College of Cardiology. So we associate diabetes with heart disease in addition to, per se diabetes having the diabetes, but linking it with its duration and other risk factors as shown in this slide. Next slide. So what are the, again, just to emphasize, what are the early symptoms to watch? If any person, we should not be unduly scared, but at the same time we should be alert, and we should be very clear in our mind that what are the early symptoms to be watched, when we should be seeking our no medical help or medical advice, or getting oneself investigated for any cardiac problem or heart problem. Top of most is shortness of breath, which we have discussed in the last 5 to 10 minutes, that shortness of breath can occur during activity or even at rest. Number two, unusual tiredness, especially during activities that previously did not cause any exhaustion. Any person will say, I have been doing this much of physical work daily, but of late I feel that my stamina is declining. I am not able to do the same work which I could do, 1 month back or 2 months back. I am feeling unduly tired and fatigued. One should be alarmed at. Thirdly, if you have chest discomfort in the form of some weight has been put on on your chest. There is a tightness of the chest, a pressure on the chest. So many patients, in my experience of 40 years, I have seen, they land up in the emergency room because they have ignored their this type of symptoms of pressure on the lower chest, tightness, or they're just passing it off as just simple gastritis. Oh, nothing was there. I just had a heavy meal. I got the gastritis or a bloating and all, but I ignored it because I thought it's just a gastritis, it will pass off. Whereas actually it was something related to heart, and they ignored it and they land up in the emergency because with the major event. So one should not ignore any chest discomfort in the form of tightness, pressure on the chest, especially coupled with some sweating or palpitation. Next is lightheadedness or dizziness, like you are at times working or walking, or even in a normal day-to-day routine, you feel suddenly dizzy and lightheadedness and a feeling of faintness. One feels that for a minute or so, I just lost my balance, or I was going to faint. You should not ignore. Now the next days come when person ignores this thing, but anyhow continuing with these symptoms, one starts getting noticeable swelling on your feet and legs. At times we will say, okay, I was traveling, I kept my legs down, and that's why I got swelling of the lower legs or feet, and it went off like this. But in case you are diabetic, and coupled with you have dyslipidemia or hypertension and all, and you have some breathlessness, some dizziness, some chest discomfort, coupled with swelling over the ankles and the feet, never ignore it, because this is the earliest sign of the congestive heart failure. We always say left heart failure, and all these symptoms we have already enumerated. These are of left heart failure, and once the swelling of feet or ankle starts, that means you are going to have congestive heart failure. And you have irregular heartbeats, palpitations, that means heart is getting affected and it is not beating regularly. There are some irregular heartbeats, again your heart is getting affected. And most important thing which all diabetics should know, that in case, for god forbid, they have to have a heart attack, you may not have classical chest pain as in non-diabetic. This is called silent heart attack. People with diabetes may experience heart attack without typical symptoms of chest pain, perspiration, sweating, and palpitation. Scientifically speaking, this is because most of the diabetics, they have some element of neuropathy, and their nerves conveying painful sensation, they are blunted, and as the patient gets a heart attack, he or she may not get the typical chest pain as is narrated by most of the people. because and silent heart disease is the hallmark of diabetic people, and one should always just keep this thing in mind. Next slide. So this was what we were explaining, was if the person is getting breathlessness, dyspnea or other symptoms and going towards the heart failure, and we should be having very good knowledge about it, and we should be feeling alerted or alarmed if these symptoms are there towards the heart failure. Now one second point comes, do you feel drained throughout the day? That was dyspnea, but there is another symptom, whether you feel drained throughout of the day. Next slide. This is what is called as diabetic fatigue syndrome. You definitely, you may not be having a heart problem, but you may be fatigued the whole day. If you are diabetic and you are having fatigue like this is called diabetic fatigue syndrome, and it refers to a condition where people with diabetes experience persistent and overwhelming fatigue. This fatigue can persist even after blood levels are controlled, and may not improve with rest, contrasting with the general tiredness that typically resolves after the sleep. Anybody in with a whole day's work, whether it's a physical work or a working on your laptop or working in your office, and you feel drained out in the of energy and feel exhausted mentally or physically at the end of the day, but one knows that after a good restful sleep and all, you are fresh and you don't feel fatigued after taking sleep. But in diabetics, if you are having uncontrolled diabetes and your disease, you are having other metabolic associated problems going on because of diabetes, you may continue to feel fatigue the whole day, and you should be seeking medical advice in case you have feeling diabetic fatigue syndrome. Next. And just to explain what are the causes of fatigue in diabetes, number one, we all know blood sugar fluctuations. Blood sugar fluctuations, whether high or low, disrupt body's energy balance, lead to exhaustion, and poorly managed blood sugars hinder efficient glucose utilization, contributing to fatigue. Coupled with that, diabetic complications like depression, anxiety, sleep disorders, such just like sleep apnea, are common in people with the diabetes, especially in obese, and they worsen the fatigue. And all the more physical strain on the heart is also one of the cause of the fatigue, because diabetes can strain the heart, requiring work to work harder, which increasing fatigue and exertion. Here I would like to point out that what I mean to say that as your diabetes, you are diabetic and your diabetes continuing, it's not only you are going to get a diabetic neuropathy, retinopathy, or diabetic kidney disease, but because of the slowly, gradually developing atherosclerosis, even small blood vessels of the heart itself, they are getting affected. And they lead to the weakening of the heart muscles also. We call it diabetic cardiomyopathy. And for that, heart has to work more because of the weakened heart muscle, and ultimately fatigue could be the first symptom in such people. And then comes the dyspnea or breathless and exertion, because the heart has to pump more and more, but it is unable to pump the blood properly, and thereby giving you all other symptoms of heart failure in the later stage of the life. So diabetes fatigue syndrome is again a very important syndrome, I will like to say, to be kept in mind by people who are diabetics, and should seek medical advice whenever they feel that they are feeling fatigued or drained out of the energy as compared to their previous days or months of working. And all. Next slide. This is again almost the continuation of what we have been explaining earlier, that even after 8 hours sleep, you feel tired. This is again a very common symptom or complaint when so many diabetic patients who come to me. Okay, sir, I have a very good 8 hours sleep, 9 hours sleep, but I don't feel fresh after sleeping. I ask them, have you any tension or any stress on the mind? No, sir. No tension, no stress. Still, they feel tired. What could be the reason? Let's see. Next slide. In diabetics, all these causes which this slide is showing are the could be contributing towards non-restful sleep in any diabetic patient. Number one, hyperglycemia. High blood sugar levels can cause fatigue, especially when consistently elevated, because they are disturbing your metabolism. And hypoglycemia. Low blood sugar levels can also lead to fatigue as the body lacks energy. Sleep apnea. This condition interrupts breathing during sleep, leading to poor sleep quality and fatigue. Restless leg syndrome. This condition causes irresistible urge to move legs, disrupting the sleep. Poor sleep. Insufficient or disrupted sleep can worsen insulin resistance and contributing to fatigue. Cardiovascular disease. Poor oxygen circulation due to cardiovascular disease, as we have already explained, can also cause fatigue. Meaning thereby, diabetics, whether they have consistently hyperglycemia or with episodes of hypoglycemia, because of obesity also, they have sleep apnea. In sleep apnea, we have disrupted oxygen supply because of our uh, obesity as well as sleep, and one gets suddenly awakened in even the fast sleep, and one doesn't get a restful sleep, and in the daytime one feels always drowsy and sleepy, and at times even amounting to narcolepsy. So all these things can contribute to about your disturbed sleep and ultimately leading to the feeling of non-freshness once you get up even after 8 hours sleep. Because of the neuropathy, one and even uncontrolled diabetes, one has to go to bathroom and again to pass urine. That again disturbs your sleep, and because of the cardiac dysfunction, you may be having some breathlessness or discomfort lying straight in the on the bed. So all these factors, they contribute to the bad quality of the sleep and leaving you tired even if after 8 or 9 hours of sleep. Next. So, leaving the three things behind: lack of freshness after sleep, fatigue syndrome, drained out, tiredness, lack of energy, and say breathlessness or going to heart failure. These are on the one side. So on the other side, if we see in diabetics, if they are doing fasting, is it also some problematic thing in diabetics? And can fasting also worsen your energy levels? Let's see. So it has been seen that in diabetics, if there is uncontrolled blood sugar or there are episodes of hypoglycemia, or you have certain medical conditions like weakened immune system, repeated chest infections, repeated infections, or you are recovering from a illness, or you have concurrent hypertension and heart failure or coronary disease, you should be very careful in doing intermittent fasting. Rather, you should be avoiding intermittent fasting, because this can give you more problems rather than any benefit. If we see this, if your HbA1c is more than 9%, fasting may increase your risk of dehydration and complications. We see so many people who are in days of Ramadan, and even in India, there are people, ladies who are doing fasting, diabetics. They are having uncontrolled diabetes, and they will go in for fasting, and they'll end up with in the emergency with dehydration on leading to diabetic ketoacidosis and all. So these which are serious emergency like conditions. So if at all you are to do fasting, either avoid it or you should be doing it very carefully under the supervision of a expert or a medical doctor. Next slide. And only the intermittent fasting can be safe if your diabetes is well under control and your HbA1c is less than 7 preferably, or between 7 to 7.5. You are not taking insulins or long acting OHAs, oral hypoglycemic agents, with a long duration of action. And you know you you are able to do your blood sugar monitoring properly, then only you should go in for fasting. And it should be started in a very gradual approach. If at all you are to land up with intermittent fasting, you should start with a smaller window, like 12 to 14 hours, before going any longer ones. As this slide is very clearly showing that if you are well controlled, having well controlled diabetes, not on insulin, non acting OHAs, and you can monitor your blood sugar, then only you, with a gradual approach, you go in for intermittent fasting. Next slide. Here, this slide very beautifully represents what I was saying. Popular intermittent fasting methods for diabetics: safer moderate fasting with an eating window of 12 to 10 hours to start with, and gradually increase to 16 hours, which can work for well controlled diabetes but requires medical supervision. Very good slide. And as written here, avoid one meal a day or 24-hour fast without medical approval. This message should go clear and fast to every diabetic and around the globe, that in the fashion of intermittent fasting, you have to do it and in a very well planned manner, go uh, go very gradually and under the medical supervision. Next slide. Now a word about the exercises for the diabetes. What we always say: you keep your BMI under control, you keep your blood sugar, HbA1c in under control, you keep your blood pressure under control, you should quit smoking, you should have a good 7 hour sleep, and you should have a good physical activity. In physical activity, to have a good heart in diabetics, we recommend, we call it isotonic exercises, not weight bearing exercises or isometric exercises, but good exercises which are isotonic exercises, like walking, cycling, swimming, and yoga, etc. But even if you are doing these exercises also, you should have certain points in your mind, things in your mind. Check your blood sugar before and or after workout. Avoid high intensity workouts if you have heart disease. Stay hydrated and carry a small snack for low blood sugar. Certain people unaccustomed to some physical exercise or activity, they have suddenly go into hypoglycemia, or they suddenly get dehydrated. So always keep yourself hydrated or carry a small snack, so that in case you feel dizzy or low blood sugar, in you can immediately have the help of a small snack. Monitor for dizziness, chest pain, or breathlessness, and stop if at all these three symptoms you experience. You suddenly start feeling dyspnea, you start having chest discomfort, you start feeling dizzy or vertigo or palpitation, you should stop your workout and take rest and get the medical advice. Of course, a general advice: wear comfortable shoes to prevent foot injuries, because we all know that foot injuries once occur in the diabetic people, they are not as they are in the normal people, because of the diabetic neuropathy and peripheral vascular disease. Any ulcer or any injury in diabetic patients occurs, and takes a long time, it is a difficult task to treat, and also it is better to prevent such foot injuries. As we always say, prevention is better than cure. So you should be careful while doing any workout, that you don't get any foot injuries, and at the same time be careful about your hydration and your hypoglycemia. Next slide, please. So what sleep practices improve your diabetic management? As we all say, a good sleep is required. Some 7 to 8 hours sleep is required for a comfortable day daily routine. In diabetic also, not only for daily routine, for a better control of diabetes, good sleep, number one, quantity as well as quality of sleep is required, because we have seen those people who have decreased sleep or disturbed sleep either because of the duration of less duration, they have less leptins, more ghrelins, they increase insulin resistance. Certain people, they have to go because of uncontrolled diabetes repeatedly to the bathroom to pass urine, they have disturbed sleep. And certain people, they have restlessness leg syndrome, restless leg syndrome, they are not having good sleep. All these people, they have less controlled diabetes as compared to people those who have a better sleep practices or better sleep. For better control of diabetes, less insulin resistance, or you can say better quality of life and postponement of the diabetic complications, you should have better sleep practices of 7 to 8 hours sleep in a comfortable non-disturbing atmosphere. And as I have always saying, that it's not only the medication, but diet control, weight control, stress control, proper sleep, and good physical activity. They are the equally important pillars in controlling diabetes and its complications in later of life, as is the medication.
Thank you so much, Dr. Karamvir. You've been very precise on t- explaining a lot of concepts to us today. So thank you. We keep the platform open for a few more minutes so that people can ask questions. And then in the meantime, I would like to ask you a few questions, doctor. So first question is, you mentioned about sleep quality, right? So for suppose someone who's unable to sleep, like 7 to 8 hours at a stretch, will that be effective if they do, like 6 hours at once during the night and then 2 hours in the afternoon? This is like a concept called sleep debt that people are trying to do, right? So they if they're not able to sleep for continuously for some time, they take the sleep after in between and all. So is that
No,
effective? Does it work?
I think it's equally effective if you can have a 1 or 2 hour sleep, as we call it siesta, or post lunch nap, and 6 hours in the night, it's equally good. Okay. But less than 6 hours is something disturbing. It's medically speaking, it has been seen that ghrelins are more secreted in such people and leptins are less, and they contribute to your insulin resistance, and thereby leading to lesser, better control of diabetic than those people who have a good 7 hours sleep.
Just a continuation to that question, doctor, which is, does so the sleep timing also matters? So one is 1 to 9 p.m. Uh, sorry, 1 a.m. to 9 a.m. the same as 11 p.m. to
No,
6
no.
a.m.
We have our pineal body, that is our natural biological clock. you know so best thing is if you can match your activity and sleep according to the circadian rhythm, as given to us by the nature. As close to that, if you can do that. I know there are so many people who have their profession like that, they cannot resort to that type of routine or living. But in case you can do that, that is better for the long term benefits, as far as your diabetes control also and its complications also, because our biological clock given by the nature plays a lot of role in you know ultimately controlling all the body metabolism of the body. So keep it as close to the nature's cycle of day and night as possible.
Thank you. Thank you so much, doctor. We also have a question from Mr. Ravindra. Would you like to unmute and ask your question?
Doctor, I just wanted to know how this Dapanom M works on type 2 diabetic patients because when I'm now
Okay.
facing the problem because
Okay.
my
Okay. Okay.
father-in-law is having the
Dapanorm M is a combination of metformin and dapagliflozin. There are two drugs, and metformin is the basic, uh, drug for diabetes. We always there's a first choice, which increases the insulin sensitivity in our body, and it doesn't cause much of hypoglycemia, but at the same time increases our insulin body and control insulin sensitivity and controls our blood sugar. Whereas dapagliflozin is a SGL2 inhibitor. It is a SGL2 inhibitor. We call it sodium glucose linked no uh, trans, transport inhibitor. The glucose we have level of glucose we have circulating in our blood is passing through into our kidneys also, and there is a filtration of the glucose in our renal tubules, and glucose is absorbed back in the renal tubule. These drugs, SGL2 inhibitors, they block the absorption of the glucose back in the blood and cause no it's a secretion through a urine. This is a independent action of the medicine as compared to the other class. I will say traditional oral hypoglycemic agents like glimepiride or glibenclamide, sulfonylurea we have been saying, or even GLP-1 analogs or DPP-2 inhibitors. They have all other different insulin related, you can say actions. But this class of drugs, dapagliflozin, has an independent action of uh, increasing blood sugar passage in the urine and thereby lowering your blood sugar. So this is the latest one and is a and these days in now fashion also, and it is a class one indication to help you in controlling your diabetes, not only controlling diabetes but losing weight also.
okay, doctor. Thank you so much.
I think it's clear about to you now.
Yeah, means after suggestion of the MD, no, means he had stopped the dopamine M, and now is sugar come down to normal level. Means started to coming down to normal level, but while taking that medicine, it was shooted to 430, sometimes 491 kind of 391 kind of. So it was pretty much a critical situation for us.
Now it's controlled. Okay, good.
Great. Doctor, I would like to ask one more question. So this is someone in my family. So she's actually on insulin. So she takes her dose every time in the night, I mean before her dinner, and she's frequently facing hypoglycemia around 4 a.m. to 6 a.m. window. So what could be done in this scenario? What is the ideal action to do?
Here we have to see which type of insulin is she taking. Whether she taking glargine, which is a basal insulin that causes less hypoglycemia. We generally recommend nighttime insulin as glargine. Lantus is the common trade name which is being prescribed by most of the doctors. The other thing is mixed starts, mixture of the short acting insulin and long acting insulin, 30% and 70%. So, in because the 30% part they cause fast action and leading to the you can say controlling the post dinner or post meal surge in the blood glucose level, and the 70% part that is taking care of the long 12-hour or 8 to 12 or 14-hour duration of action. So, in case one is having hypoglycemia in the early hours of the morning, she should preferably get a midnight blood sugar done before. You know, that time if her blood sugar is getting lower, we like to reduce her dose at the midtime, at the pre-dinner time, or change the quality of the insulin which is taking. Uh, 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 from 30/70 we can shift to 50/50 or to glargine. I think you can refer her to me I'll guide her looking at her, you know, mm, I will say in case she's on CGM, according to the CGM, or in case she's not having CGM, looking at her pre-dinner and post-dinner blood sugar, as well as the type of insulin which she's taking. I'll set the thing right. No problem. Not a big issue.
Got it. Doctor, we also have one more question from Kevin. So sometimes I'm getting stressed before going to my bed due to my work, but I'm getting 8 to 9 hours of sleep. But still, I'm going to my bed with some kind of stress mentally. Will my body get impacted due to stress during the sleep process? And does it also make a difference in my blood sugar levels?
Obviously, occasional stress will be taken by the body in a normal routine, but you are constantly having this type of thing. It is going to continuously have higher levels of your hormones, of stress hormones. Okay, just like we are going to for an interview, or you are having palpitation, your heartbeat is high, you have some perspiration and all. This is because of the more of noradrenaline and adrenaline being secreted in the body. So if it is on the lower front level, and but at the continuous level, all these hormones, they are supposed to increase in blood sugar level. So ultimately, you are going to get affected. It's better to have a stress-free, calm mind once you are going to bed. Learn the way to go to the bed, as we had done so in our last, webinar. There is a way how to we go to bed. Not to take any stimulant drug or any stimulant tea, coffee or something, or you should have a calm and dark atmosphere, and not, or you can indulge in, I will say, indulge in some light reading or some light music or bhajan or something, so that your mind gets relaxed and gradually goes to a good sleep. But continuously going to the bed with a stressful mind to sleep is not good in the long run, both for diabetic as well as hypertension.
Got it. Thank you so much, Doctor. We also have question from Mr. Bikramjeet. Please unmute yourself, Mr. Bikramjeet. You can take it.
Yes, doctor. I have a question around like stages of sleep. So we have REM sleep, light sleep, and deep sleep. So we find that lot of different views on it. That what percentage should be REM sleep, what percentage should be light sleep, and deep sleep. So what's your take on it? What should be the ideal division of these stages in the sleep?
Frankly, I'm not a sleep expert, but it varies individual to from individual to individual person.
Okay.
Hello.
Yes, yes. So
It varies from individual person to individual person. And those people who are not having good duration of RM sleep, then melatonin is the in thing which we are prescribing these days.
okay, doctor. So you means to say that there's no standardized thing like over a research. We do a
Yes,
research
it
on a
needs
certain
more.
community, and we develop some
It is
like
very, yes,
a
I
range.
agree with you. It is varies from person to person, from community to community, from professionals, different professionals. There is no, in my knowledge, there are no standard, you can say, uh, subset of duration, that this much of RM sleep or this much of.
Got it.
Oh,
And
thank you,
uh,
doctor.
just adding to that point, Doctor, I think while the sleep metrics in general are just an indication of the quality of the sleep, the real way of assessing the quality of the sleep would be how one feels when they wake up, right? Or how undisturbing their sleep was for those 8 hours. So I think
Yes,
that is one of the main quality
this is what
indicator
we
of
have been.
someone's sleep.
This is exactly Apurva. This is what we have discussed in our earlier slides also and our earlier webinar. It is the quality of sleep which matters. How relaxed you are, how undisturbed sleep you are. Absolutely right. Sure. I hope have come to the expectations of all the attendees, and I'll be available always on Heald for any queries or any type of you can help. I can be of not only for diabetic reversal, diabetes management, its complication, and other issues. Thank you very much. It's my honor and privilege to be with you all. Thank you.